Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Welcome to the show.
Hey, HeHe.
Hi, I'm so excited to have you here. I shared with everybody already how we met, but it's just so nice to see you since the conference. I wish that we were in person that I could give you a hug, but unfortunately, no go on that, but that's okay. Yeah, today's conversation is going to be super fun. We're talking about the golden hour, so that time right after your baby is born. But what exactly does the golden hour mean? Does it mean the few minutes, the few hours, that first day? What exactly are we talking about when we say the golden hour?
The golden hour in the hospital scene is like literally an hour.
Yeah.
They will mark
60
it
minutes.
at an hour. Okay, hours up. But it is a time period, and it could be an hour, it could be 2 hours, 3 hours, 4 hours, whatever you deem you need to connect with your baby. And this is usually pertaining to mom and the baby because of all the benefits that you get from it. But I always like to consider it like a little family golden hour. This is the time that things should really slow down, get quiet, dim the lights, and connect with your baby and you're in this transition that you just had. So I'm really happy that they have made, they meaning the hospital system, at least here in California and the places that I've worked at, like in the West Coast. And this is a thing, like they really promote the golden hour. So you will notice nurses like right after delivery, after you get cleaned up, they want the baby skin to skin. They're going to promote early breastfeeding if that's your choice, dim the lights, and hopefully give you a little bit of space and time to do that connection. And I'm really glad that has become kind of common practice nowadays.
What about all the other things that are typically happening in that golden hour as well, like fundal massage and like stitching, if there is any tearing, anything like that? How does it interfere? You can still do golden hour. Having your baby skin to skin will provide you with some pain relief, so it's actually a little bit positive. But what do we need to know about it may not be a super hands-off process?
And sometimes that repairing can take a whole hour. So
Ah,
it's a bit like subjective, I suppose. How I at that point, then my golden hour doesn't really start until everyone is out of the room and things have calmed down. But you can get the benefits of just going skin to skin right after delivery if you can, if the baby is vigorous and doing well, then skin to skin in your chest. You can start breastfeeding with your legs up while the doctor is there doing your incision, making sure that your pain is under control, and you just continue on as needed. Is it the most ideal situation? No. Hospital is you're going to come up with a lot of those. Okay, this isn't ideal, but we're going to find the outlook on what we're looking at, right? So if the doctor's in the middle fixing you all up, that we want that.
yeah.
And if they're and if you're just out of it at that time, if you're not feeling well, if it's a cesarean and you're just like nauseous or anxious or even passed out. I see women just pass out.
Mm.
You can start that golden hour as soon as you are connecting with baby. So once you're alert, maybe you're okay handing the baby off to your partner while you're getting repaired, because it was just like maybe 3 hours of pushing and there's nurses everywhere and you're nauseous. Not every woman feels so up to it right after you deliver, but you're not going to be stolen that time away from your baby, because as soon as we get you comfortable and your legs put back together and the bed's put back together and you're comfortable in the quiet, then we can connect you with the baby. If you had a C-section, we can do that in the recovery room. And that is a time you're going to get those benefits of skin to skin and looking in your baby's eyes and touching her little hands, and maybe start breastfeeding if you feel comfortable. So it doesn't have to be immediately after birth. It's ideal, but not all things, especially in the hospital system, are going to be ideal. So as
Yeah.
soon as you can, and as soon as your baby can, even if that means your baby went to NICU, then go see your baby as soon as you can and get that golden hour, that really precious time that you can connect with your baby.
Yeah. Oh my gosh. Okay, so what are all the things that are going on in that golden hour? We don't have a shirt on. Our baby's probably either naked or just in a diaper. We're doing skin to skin. We may be attempting breastfeeding. What else?
Yeah, you did ask that question about the fundal massage too. And I noted it and then I forgot, but there's a lot going on.
Hmm.
Definitely in the first 5 to 15 minutes, where the doctors are pairing, your nurses are scrambling around, making sure you get Pitocin if you need it, and massaging your uterus, getting those any clots out, or checking the placenta, making sure you're finished with the third stage of labor, the placenta is delivered and it's intact, and all these little things that we do as nurses and doctors while you're potentially skin to skin with your baby. And then all of a sudden, everything's done. You're cleaned up, your gown is on. And then our assessments as nurses in the hospital continue, but less frequently. So it's depends what you think of as frequently. About every 15 minutes, we are going to want to check your bleeding. So we're just gonna, hey, can I just check real quick if that's okay? I'm gonna peek inside. If family is there, that's okay. We're very discreet, or we can ask them to step out every 15 minutes. It's up to you. But we just peek inside and we need a good look. We need to check to make sure the bleeding is not too much and your incisions are intact and you're not bleeding from any tears, bruising, or lacerations. We want to make sure your fundus is firm. So that they say fundal massage on every 15 minutes. It's really not a fundal massage. We shouldn't be massaging the uterus unless it's soft, but we need to check to see if it's soft. So we do have to push down pretty firmly to get a grasp and feel for it. If it's firm, I'm done. And they're like, oh, that was it. I'm like, yeah, it's hard as a rock. I don't need, I'm not massaging anything. You don't need it. But if it's soft, then I do need to do a bit of a gentle massage. And I say gentle sparingly because it's uncomfortable,
Mm.
but it is the first thing we do to make sure, because it works, to make sure that uterus gets firmed up and bleeding is minimized. So yes, every 15 minutes, we check your fundus, and most likely your blood pressure cuff will go off. So we're checking to make sure your bladder isn't getting too full. We're making sure your pulse is normal, your respirations, your temperature, your blood pressure. We got our eyes on you. And in the meantime, we're also every 30 minutes checking baby's vital signs. So we can do baby's vital signs. We can do baby's medications. Medications, we can even wait till after that golden
Mm.
hour if you want to. We can wait for everything on the baby except the vital signs and a general assessment, which we can do on mom, and we can do very quickly. So it takes a minute to do baby's vital signs, and it takes that long to do mom's, and then we're out of there. I do.
Ex Explain what that would look like. You come in, baby is on mom's chest. How are you doing these tests on mom? Just in case anybody runs into somebody that says, I have to take your baby. It's time for me to do this. What should they be expecting instead if they were hoping to have care done right on their chest?
Oh, yeah. You just ask them, is this something that you could do on my chest? Because I'm not ready to separate from my baby yet. And they're like, no, I really need to do that. I'm like, what exactly are you going to do? Like, explain it to me. And if you find reason, because there may be something, I don't know, maybe they had a complication in their delivery and
Mm.
they had to take baby over because they weren't breathing correctly right away and they needed a little extra care. And they just want to be able to see, sometimes like with retractions or certain breathing issues, they can't see that on your chest.
Sure.
So if they explain that, I just need to make sure maybe they listen to the lungs and they hear the baby struggling a little bit, or the mouth is turning a little blue or something. They're getting their little spidey senses, and it's, ooh, I don't, maybe the baby's a little too jittery.
Mm-hmm.
We can't do a full proper assessment. So if they explain for the baby's safety, I just need to really make sure that the baby's breathing okay and not too jittery. And at that point, you may decide that will probably be better than continuing the golden hour. And it'll probably be in like 5 minutes or 2 minutes to just lay them flat so they can really get a good look at them. Other than that, if it's like baby medications or just general vital signs or even the diaper, it can wait. The diaper, honestly, you can put a blanket right under their booty and you're okay. I highly recommend it because meconium is hard to get off.
Yeah, it is.
But you
It's so
don't
sticky.
necessarily need a diaper. And I just throw a diaper like right there on it, barely taping it down, but just to catch anything that comes out. But yeah, other than like a more serious assessment that your nurse deems appropriate, I don't think you need to take the baby at all. And so just asking, well, what is it you need to do? Is there something wrong or is there something you want to check out? Yeah, I just need to really make sure that baby's a little jittery or I hear something in the lungs. And then, of course, it's your decision, but I would say by all means, but and then just stress, but golden hour is very important to me. I really need this time so that they're not diddle daddling over there.
Yeah. And so that you can have more of your golden hour when they bring your baby back, right?
Yeah.
They will know that your goal is to get your baby back as quick as possible so that you can continue your golden hour. Okay, let's talk about some of the benefits of the golden hour. So, we have a lot of benefits that come from skin to skin and breastfeeding. What do people need to know when thinking about the benefits? And maybe if there are any risk also to the golden hour?
The only risk I would think is what we had just talked about is if you're denying the nurses the chance to help resuscitate or give proper care to the baby when they really
Mm,
need it. Is low and they don't know, or baby's jitter and they don't get a full assessment, and then you can miss stuff that way. Other than that, I don't know of any other risk to skin whatsoever. I get a lot of I like skin to skin or the golden hour with dad holding the baby's skin instead of mom, and for thermoregulation for the temperature of the baby, and just the smell of dad and to connect is great. I think it's better than nothing. But if you want all the benefits, really, it's mama. Because this is where baby has been living for 9 or 10 months, or maybe a little less, but it doesn't matter. That's where mom is going to get that rush of oxytocin, right? Smelling the baby, seeing the baby, touching the baby, using all her senses to increase her oxytocin supply. And what is that going to do? It's going to help with her milk supply to come in. It's going to help with her mood and decrease the chances for postpartum blues or depression, anxiety. Yeah, it just helps with the bonding. And if the placenta hasn't been delivered yet, because of that rush of oxytocin, it's going to help with the placenta being delivered, which is going to help with postpartum hemorrhage. So the list goes on, and you just need that time. This is the first moment you're meeting your baby. And for the moms that get separated too soon, there's a reason why it's very difficult. There's a reason why they look at it like, oh man, that's stolen from me. And I hope there's a good reason why it was something like a cesarean or baby resuscitation. It's a good reason. And you should be able to get that as soon as you can and get all those benefits either way.
yeah.
Yeah. For the
Yeah.
baby, it's going to help promote the transition. So yes, it's great to go to dad, but they're used to mom. They're used to mom's heartbeat. They're used to mom's smell. They're used to her voice, everything. And I think they can still get that effect with I like listening to his heartbeat and all of this, but it's just to reduce the baby's stress and the baby's anxiety to just be with something familiar because it's such a huge transition. I can only imagine. So
Yeah. Your baby's going through, like you said, a big transition. Their lungs are learning how to do everything on their own, their vascular system, their cardio system. Oh my gosh, all their systems, their
Mhm.
adrenals, their lymphatic system, their lungs,
Senses,
yeah, literally all
smells
of their
and
brain
sight.
and all of it do
Oh,
life.
they associate your voice to that face, and they're like,
Yeah,
"Oh,
that's my
hey, that's
mom, I know
you.
her.
I love
Yeah.
you." And then they start smelling and are like, "What's that?" I was like, "Is that?"
Food.
Yeah, let me give me some of that. And all of a sudden, yeah, it's pretty cute actually.
That's funny. Okay, while we're at it, let's talk about the breast crawl.
I haven't seen, I think I've had one mom in my 8 years request that
Oh,
happen.
really?
So I
Wow.
haven't seen it in person, but I've watched videos and I think it's something else for sure. Where I say where there's a will, there's a way. Those babies
Totally.
will crawl up.
Yeah.
And to me, like my takeaway from the breast crawl is you don't have to feel this like urgency. Baby's hungry and I need to put the baby on right away. Like let it work for it a little bit. It's okay. Like you're gonna start seeing them rooting around and looking for it and smelling it. And that just goes to show you too, like how instinctual it is that they're smelling, they're looking around, they're catching it, and then they get this confidence and their body just starts crawling. Newborns have the sense of crawling. If you hold them up, they're gonna start going for it. It's so cute. But yeah, and so for me, it just means slow down. Everything can slow down a little bit. If the baby can crawl to you eventually and be okay, just like the little kittens and the little piglets I see, they're just like they get delivered and they crawl over to mom. Mom's not going anywhere. She's just laying, she's not like grabbing her nipples and shoving it in the baby's mouth or anything like that. They're just come and get it. And the runts maybe need a little help, but your baby's gonna get what it needs. That's my takeaway. So
Yeah.
you don't have to feel so anxious about the baby's hungry. I need to put the nipple in the mouth right away. Like take your time. Once you see him rooting around and looking for it, then that's the perfect time.
Yeah. I've been blessed to be able to see the breast crawl a couple of times. I think our
So
clients really
cool.
fancy that idea. We also
Yeah.
do a number of home births, so it's common in home births as well. So we've gotten to see it fairly often, and I think one of the things that sticks out to me is how odd it is for hospital staff. They want to move that baby. They want to pick up the baby and move that baby. They want to physically latch that baby. And so
Yes.
much like you, I am really overcome with the idea of like your baby can do it themselves if you just give them the space and we're not in any sort of super urgent rush. I know that there is some data out there that says we want your baby to eat quickly after birth in the first hour or two after birth to make sure that they have food in their bellies and their blood sugar can be stabilized and to start practicing that latch and to get that colostrum. But sometimes in the hospital setting, we find that people have their babies, and literally within minutes, someone is there saying, let's latch this baby. And it can really be just too much, too strong at not the right time. And that can sour your breastfeeding relationship. So if hospital staff, if anyone out there listening, and you're a nurse or an OB or midwife, just know that there's a time right after birth to just like honor that duo that is just kind of meeting for the first time on the outside and let them figure it out. That baby will latch. They'll start to do all the signals that we all know as hungry baby signs and cues when they are hungry, and we can lay them belly down. And I promise they'll walk over to that nipple. They always do, always. What was I going to say? I was going to say something else. Oh, one other benefit that I wanted to talk about in terms of breastfeeding as well is skin to skin is a really wonderful way to promote breastfeeding. Not only is it super easy access right there, but also it helps promote good milk supply and for your milk transitioning in. So keep your baby close if you can.
Yeah, it stimulates everything. Our bodies and our systems is a feedback system. Being able to smell your baby, hear your baby, touch your baby, and then the baby starts smelling and starts suckling, whether it's a good latch or not, you're gonna have a response system in your brain and your system of the oxytocin and prolactin, and everything's gonna start waking up and be like, oh yeah, party time, let's do this. And a lot of the questions like, but do I even have milk? It's really thick colostrum. The baby sometimes has to suck for quite a bit to start seeing it sometimes.
Yeah.
And your nurse will assess and the lactation consultant will come in and the nurse can help you. But I just hate to see new parents start stressing during that first hour or two, like preoccupied with, am I doing it right? Am I getting this? Is the baby hungry? And they're looking at me with these pleading eyes of, help me. Am I doing this right? And whatever you're doing is right. Like, just all the baby wants is to look at you and be with you and smell you and love you. And when you're ready, when you feel in your body you're ready and instinctually your baby's ready, then I'm here to help you and we can do it. But it breaks my heart when I see them so worried, so anxious, and no. And then it's my job to calm them down and tell them they're doing everything right and it's not a rush. And we'll let you know if it's anything, if that baby's hungry. That baby was just fed. That baby has been feeding nonstop for 9 months.
Yeah.
They'll be okay. They'll be okay
Yeah.
for 5 minutes. And we know the signs to look for when the baby hasn't eaten, but generally we do want them eating within 4 hours. So that's plenty of time. And it's more so, it's not so much as hunger as your connection and getting the whole process started, but it's not a rush. You're absolutely right.
Yeah. Just because you touched on it, and I think now people probably have the question, what are the signs that a baby is maybe dehydrated or isn't consuming enough calories or food?
Low glucose, what we call it, because your main function that the baby needs is sugar. So your breast milk is highly concentrated, especially the colostrum, in sugar and fat. So if they're not getting that right away, we may see little signs of like jitteriness. So they're like shaking or trouble breathing right. So you can see the refractions kind of breathing, or we hear it when we listen in with our stethoscope to their lungs. Pretty severe is very lethargic, like they're just floppy and very tired. That can be signs that it's very low. And we're always worried about that because it means it can affect the brain, because the brain needs a lot of sugar especially with gestational diabetic mothers, that the babies are probably more used to having a lot of sugar. And then all of a sudden their supply's cut. So that's why we check the blood sugars on baby, and we can do that while you're skin to skin. So we prick the heel and we just check we do that automatically. We'll check the blood and make sure the sugar levels are good. We'll do that every few hours. And if baby's good, then you continue on. At that time, if your baby is struggling a little bit, if your nurses see it, or if you see, hey, baby's not really as reactive, or is a little jittery, or is this right? Is it breathing right? Please ask your nurse to double check. And they'll assess, and they'll probably just check the sugar level, and they'll either try to promote you breastfeeding at that point, or they can offer you a little bit of formula just for their safety, depending on how low it is, or even a little sugar that they have in a liquid form.
Yeah. Okay, you had mentioned a NICU stay previously. What about skin to skin in the OR? I know that comes up often. What should people know about doing skin to skin in the OR if they have a C-section?
It would be something that I would definitely want you to request or ask about before your C-section because of staffing, because we want a nurse there in the room, because your labor nurse is circulating and will be responsible for you, but the baby nurse needs to be in the OR with you handling the baby. Sometimes that's a NICU. And just depending on how your hospital's staffed, it's usually like the NICU nurse, and then they pass it off to the postpartum nurse in recovery room. Just depends. All I'm saying is if that's really something you want, we would normally love to offer that. And we just need to plan ahead for that and make sure that everyone is on board and understand that's something you want. And the doctor as well, they may need to make a little bit more room in that area with the drape to be able to access your chest and skin to skin and get baby in there. And if that's something you really want, I hope you get it. And I hope we work as a team to make that happen. But also understand that the number of moms that have had cesareans that I've delivered a lot of cesareans that are just not up to it. So if you're saying, I want skin to skin, I want a gentle cesarean, and I want the baby in the room with me the whole time, and you have this plan, and I think it's lovely. Do not feel guilty or bad if in the moment you're like, yeah, that's nice, but why don't you hold on to her? Because you're laying flat, you're pretty uncomfortable, you're literally in the middle of surgery.
Yeah.
You're probably, after baby is born, you could be getting a few medications for if you maybe were trembling or super anxious or in a lot of pain. There's certain medications we don't give, or the anesthesiologist doesn't give while you're pregnant, but as soon as baby is born, we give it to you, and that can kind of zonk you out. Or even just, let's say you've been laboring and pushing for 20 hours and you're exhausted and you ended up in a C-section and you're like, I just want skin to skin. I have this plan. You're like, okay, beautiful. We'll try. But the second the baby's born, you're like snoring. Like that happens and it's okay. And we're going to connect you and you're going to have your skin to skin in recovery when you're feeling up to it. So I don't want anyone to feel bad about that, but still understand that we can offer it because there is a chance that you're going to feel totally up for it. You want skin to skin, your hands are free. Make sure that your hands are free so you can hold on. And I've seen moms breastfeed on the table.
Wow.
I've seen, yeah, they just pop it out and, you know, I was like, here we go. Okay, get it. Because that's what they felt comfortable. They didn't, and guess what? They didn't ask permission. They didn't do it. They're just like, help me get my baby. Okay, no one's gonna say no, you can't
Yeah.
at that point. So follow your gut and do what you feel is natural and that you want to do. And if it's an urgent one, you've been laboring and you never had that conversation about having skin to skin in the OR, and then all of a sudden you're getting rolled off and you're about to have your C-section and you're laying on the table, that's the time you just ask the anesthesiologist. They're right at the head of the day. Hey, I really want skin to skin. Can you make that happen?
Yeah.
They'll let your nurse know. And your nurse is one of your biggest advocates. So is the anesthesiologist. We are all advocating for you. So if we can make it happen, we're going to run around and get a nurse in there and make your wishes granted if we can.
Make your
So
wishes come true.
yes. That's one of my wishes.
I love it. Okay, I would love to talk about just a brief overview because I realize this should be a whole podcast of its own, but can you just give us a brief overview of the things that we can expect them to offer to do to our newborn? You mentioned the heel prick. Something that comes to my mind is the erythromycin eye cream, so make sure you know about that. The Hep B vaccine, so make sure you know about that. What else should people know about that may be offered in that golden hour? But again, all of these things can be delayed. Even that blood sugar prick, does that happen after that 1 hour mark?
Sometimes. Sometimes they wait an hour, sometimes they wait 30 minutes, sometimes they want it right away. It depends on the doctor's orders and the hospital policies. So
Okay.
if you are a gestational diabetic, you can ask that before you go in or talk to your doctor at one of your prenatal appointments. What are the policies? Just so you're aware. The heel pricks, all of those things you just mentioned, we can do on you. So what you can expect right after delivery, we'll give the APGAR score. That's a communication tool. It means nothing for you, really. Then we'll take the vital signs at the first 5 minutes that we can do on you. We're just listening to the heart rate and the respirations and checking the temperature. And it's more of getting a baseline for the transition. So as your baby keeps adjusting to this new outside world, we want to see how they're transitioning. So it's not, oh my God, we just want to see where they're at. We don't do too much if the temperature, we're not expecting them to ace this test. They just came out. Then we want to usually do their vital signs like that, which is, like I said, a minute. About every 30 minutes is general practice. But again, all hospitals may be a little different. We can offer them medications. Now, nurses like to bundle their care and do everything at once. And sometimes that does mean in the golden hour because some hospitals want us after an hour after delivery to get you packing and going up to postpartum. And I'm
Oh
like,
my
the
gosh.
doctor just left. The doctor just left the room and I just got the blanket on her. So I take my sweet time, but you may get a nurse that doesn't. And it's like, hey, we're busy. We're slammed. All the rooms we have 2 women laboring in triage. We need this room. You're done. And we got to go. You just, I hope you can be somewhat of a team player because you can get all of that continued, your skin to skin in postpartum. But if you need time and if, the doctor just left, I need some space right now, ask for it.
Oh, really? It's okay to say, hey, I know that you're probably working under a time crunch, but we're feeling super rushed. Could we just
Yeah.
pause and maybe bring the energy level down in the room?
Yep. A thousand
Cool.
percent. And I will say, okay, when I always say ask for more time. It doesn't matter
Yeah.
if you're at the start, you just got admitted, or you just delivered, or they're trying to rush you out. Yeah, you said it perfectly. I just feel like I'm a little rushed and I just need a little more time. Can we get another 30 minutes? You
Hmm.
know, get just ask for some time. The worst they're going to say is no, and I hope they have a really good explanation and leave a Yelp review later, but it's okay. We manage it all the time, and we're advocating for you. So if you ask me for another 30 minutes, I'm gonna look great. I needed another 30 minutes too. So I'm gonna go tell my charge nurse, like, hey, she'll be ready in 30 minutes. And then I'll probably get barked at a little bit because they're the managers and they're the crunch times, and I can take it. So I'll be like, okay, or I'll stall. We're really good at stalling. Like I'll I'll go find a hundred things I need to do to prepare you to go to your room, and you'll never know. So if you just ask me for 30 minutes, I'll figure it out. But if you don't ask, then you're not going to get it, right? And that goes with everything. If you go to a
Yeah.
restaurant and you get the wrong order, or you don't like what you have and you just go along and eat it, then you're gonna get what you got served. Or if you ask for something, they will probably give it to you, right?
Oh my goodness, I love it.
So yeah, definitely. And if you don't want any of those things, you mentioned the baby medications. Yes, all those things can wait until after. I definitely recommend, if you're planning on breastfeeding, and even if you're not, wait until the golden hour to put that erythromycin in the eyes so that your baby adjusts and can see you. They do
Hmm.
see, they do
Hmm.
have vision, and they will see your face. But if you immediately gunk them up with that ointment, that's kind of stealing
Rude.
rude, like gross.
Rude.
But a good time to get the weight. So we want to check the weight, we want to do the measurements, we need to do all of that. And honestly, it's only been about like 5 years or so that I've noticed a huge change in, like, the doctors used to need the weight right then because they were
Hmm.
writing the report, and then they needed to go home or go back to the clinic. And part of their report said weight of the baby. So they needed that weight right away. So I saw a lot of times the nurses says, no, the doctor needs it, or we need to admit the baby, so we need the weight of the baby. And I would always be like, no, you don't. No, he
Hmm.
doesn't.
Hmm.
He can get it later. He can add it later. You can admit the baby without the weight. And they would just say, no, we can't. No, we can't. No, we can't. And then lo and behold, they can. So you really got to advocate and push for things, because what's more important, like the doctor's notes or having that time with your baby uninterrupted? The baby's weight doesn't change much, I promise you, in an hour. So
Yeah.
we should be able to do everything except if the baby is struggling and needs help. So like we had said already, that's a great reason that we're going to have to move them for just the time that we need to the warmer. And your husband's right there. And that's sometimes I see a lot of time, like right after birth, let's say you didn't have a tear, we're cleaning you up, and it's just like a lot of going on. Like you have these dirty blanket or you have this on, you're just messy. And the nurse will say, hey, while we clean you up, because they have to roll, let's say you have epidural, we have to
Hmm.
roll you side to side. And we're like, hold tight to your baby, and that's fine. We'll roll you side to side. But if you want to hand the baby over to dad at that point, or to another nurse, and she could, while you're all cleaned up, they can go ahead and put the diaper on and weigh them and all that. As long as it doesn't take too long and you get the baby right back, that's perfectly fine too. We do that all the time. Sometimes we can go a little quicker when you're not holding the baby, but not necessary. We're very good at cleaning you up while you're holding the baby too. So it just depends on how you're feeling. If you're feeling overwhelmed having the baby and then everyone like cleaning you up, then you can take a breath. Let us take the baby for a moment and clean you up, put a new gown on, maybe fix your hair a little bit. And then you sit up, and then we bring you your baby and you go right back to it. So you run the show. You just got to let us know how you want to run it.
I love it. Oh my gosh, I love that so much. Okay, my final question is for anyone who is struggling because they didn't get this golden hour and they really wanted it and they were really looking forward to it. And for whatever reason, it just didn't happen for them in the way that they had expected. Maybe they got it later, maybe they didn't get it at all. But what do you say to people who are out there feeling a little sad because they didn't get this time honored with their baby?
That's such a good question. And I'm not even sure I'll get this right because I went through it with my first baby. I think I got the golden hour, but I was so out of it, like so freaking out of it that I didn't appreciate it and I didn't notice it. So it's almost like I didn't. I feel like it got robbed from me because I think they gave me some narcotics, some medications that kind of made me all loopy and I didn't connect. I also didn't know what I was doing, but okay, that's besides the point. So what would I say to myself or what would I say to someone? I would just say, I'm sorry. Like you have to acknowledge that you did get that robbed from you. We can't pretend that you didn't and then try to look at what you did get. When did it start and how is your baby doing? And look, I have to acknowledge the loss there and say sorry. I always do. And I'm so sorry that you didn't get that. I wish that for you. And do you want to talk about it? And they can talk about it. It's good to get it out. Good to express your feelings. It's okay to feel that kind of loss, acknowledge it, and then let's look at what you did get. I see that with NICU moms all the time. It's really sad. It's really crushing, especially when they are looking forward to it so much and they read all about it and they listen to this episode and they're just like, yes, I see all the benefits and I want this for baby in this magical moment. And then it doesn't turn out that way. I'm crushed there, right there with them, honestly.
Yeah.
It breaks me too a little bit. And I've been there and I got my golden hour with my last baby, so I saw the difference. But guess what? I got many golden hours at home and I made sure I got plenty of skin to skin when I got home and loved on her for the last 24 years. So you can get that time. And I'm sorry you didn't get it right after birth. And it's a struggle, right? That's life. That sucks.
Yeah.
But I don't know. What would you say? I don't know.
Yeah,
You're
I
so good at
think
these things.
no, I think something along the same lines of I'm really sorry that was robbed from you. Just acknowledging you wanted that, you had done the work to do it. There was an opportunity for it to be done, or maybe there wasn't. And those are
Right.
two different situations. If there was an opportunity for it to be done and that was robbed from you from somebody, I'm really sorry about that experience. If it was taken from you and it wasn't an opportunity because you needed medical care, your baby needed medical support, then we have to think of weighing the things. We gave
Right.
up skin to skin in the immediate after birth in order to get your baby on a CPAP machine immediately after
Right.
birth, and you were able to get because we got your baby on CPAP so quickly after birth, you were able to get skin to skin within 24 hours, where
Right.
typically babies in that situation, we sometimes see them go days or weeks not having skin to skin, right? So I think
Right.
as always, it is very personal and I don't have very strong feelings either way, but just to validate that person in either, yeah, that was robbed from you and that's not fair and you deserved better. And I wish that had been different for you. Or, yes, I'm sorry that you didn't get that. I really do hate that for you and your baby. I wish that it had been different, but I don't think that you made the wrong decision. I wish you could have had both, but you couldn't. And I think getting your baby on the CPAP machine did ultimately rank higher than getting your skin to skin immediately after birth. So if you're
Yeah,
asking my
100%.
opinion, I think you made the right decision. And I would probably build them up and say something like, and that shows me you're a good mom already. You're already doing it.
And
So
if it was something that was someone else's fault that you didn't get it, they just blatantly didn't ask you or just went about their business and interrupted your golden hour, then that can probably bring up some anger and some of
definitely.
those feelings. And that's what I do, because then in that case, education is so powerful. If you have moms that start asking you about golden hour, or you can start educating other women on creating a birth plan and educating and communicating your preferences like that golden hour, skin to skin, uninterrupted. You can say 2 hours, 3 hours, 1 hour, whatever it is, with your partners, with your doula, with your nurse, every nurse that walks into your room. You need to communicate those feelings and preferences to your doctors, every doctor. Make sure everybody knows, because then if you have 5 people in that room that know you want uninterrupted golden hour, and then you have a new nurse that comes walking in that doesn't know anything, and they're like, okay, I'm just gonna take your nurse, then you're going to have 5 people in that room be like, no,
Stop.
she's
Start
alive.
lunging at her. Slow motion.
Right. But if you only have 1 or 2 people and they're preoccupied or they don't see it, and you have 3 other people that are like, yeah, that's a good idea. You should take the baby over and weigh it now. Then you're like, your back is against the wall sometimes, or you're still feeling out of it, or it's hard to find your voice in the hospital. It's so hard. And that's why I do these birth plan workshops, and I try to speak out about birth plans, because the preferences and communicating them are so important. So it doesn't matter what is on your birth plan. It doesn't matter what your preferences are. If you want golden hour, great. But if you just write it down and you don't tell anyone, and 2 people look at your birth plan and the rest of the team in that moment start interrupting and making those adjustments and robbing you of that, then, that could have been preventable. A lot of that could have been preventable if you just became the leader, became your boss of that birth, and let everybody know the plan of action. And there is a chance that you could have prevented that, and then a lot of other things that had to do with your birth.
Yeah.
Big advocate for that, and educating yourself and speaking up before you ever get into the hospital.
Yeah. Oh my gosh, that's why I love you. Truly, thank you so much for being here. This has been such a good conversation. Yeah, absolutely. Look, if people wanted to connect with you or learn from you or get any of your resources, how can they do that? How can people connect with you?
You can find me pretty much anywhere at My Friend's a Nurse. So on Instagram, TikTok, I usually live there. Facebook, I have a Facebook page. Starting YouTube, but I just started my own podcast. It's the Birth Link podcast by My Friend's a Nurse. And yeah, I'm just starting, so I'm still learning all of the ins and outs, but I really love it. And I love being able to connect with new parents and just people that are loving birth, right? The birth world is amazing, so why not?
Yeah, absolutely. All right, you guys. I'll see you in the next episode. Be sure to follow Colette on social media, and you can find me at Tranquility by HeHe or at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I truly do value this community, and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.